All right, we ready? Okay, so we're looking at the sheep brain here, and intact, it would look like this, the entire structure. What we're missing is the outer covering, which is the dura mater, and beneath that, which you can sort of see remnants of, it, kind of stuck in the sulci, is the arachnoid mater. An arachnoid means spider-like. And then the layer that you can see right on top of, or stuck to the brain itself, that shiny layer that I'm kind of able to see right here, is the pia mater. So it goes P-A-D. It's a pad or cushioning for the brain, which are the layers, pia, arachnoid, and dura. So you'll see the cerebrum, both the cerebral hemispheres, versus the cerebellum. Of course, I did a sagittal cut right here so you can only see one side of this. And let's talk about the major structures first. This is the gyri, and these are the sulci, which are the valleys or deeper lines. And even deeper, we have a fissure. So this one here that connects both the cerebral hemispheres together is the longitudinal fissure. And this is considered a fissure back here, which connects occipital lobe with the cerebellum, and that's the transverse fissure. Okay, so there is one sulcus that looks like we can go all the way across, and that's that one right there, called the central sulcus. So immediately anterior to that, that's the precentral gyrus, and then this, either side would be the postcentral gyrus. We'd have our motor control, our sensory control, and that's where that homunculus came in from lecture. So let's look at the lobes. This is my frontal lobe, and that central sulcus is kind of your landmark. For prior to that is frontal, and posterior to that would be your parietal. On either side, I'm just going to do one lateral view here so you could look. On either side, this is the temporal lobe, and then closest to the cerebellum would be your occipital lobe. I'm going to do one nice thing here and cut a little bit deeper into one of the lobes so that you could see when we make an incision, it's clearly a different type of tissue that you see than the cortex. So the cortex represents the outer portion. When we get inside, this is the insula. Okay, so it's a different material. The easiest way to see it is through the temporal lobe, and it's almost like the inner portion of the cerebral hemisphere. Okay, so what you can see prominent on the brain is remnants of the olfactory bulb. Olfactory bulb is your first cranial nerve, and we'll start talking about cranial nerves later, but I'm just going to show you the ones you can kind of already visualize on here. This is where we took out, extensions of the brain are considered the eyes because they're really come from this region here. And then those optic nerves that we talked about in the skeletal system that went through the optic canal, those cross, and they are right here. So these are the optic tracts that you can see, and they would cross. You can't really see the cross really well, but they go all the way here, and the cross itself is called the chiasm in the center. So optic chiasm is where they would cross. Directly underneath that, like hanging from that, would be a stalk and a gland called the pituitary gland. So in my skull, where I'm at is in the sella turcica of that sphenoid. So if you can picture. So when someone has an enlarged pituitary gland because of an adenoma, one of their first symptoms, typical symptoms, is blurry vision or trouble with vision. And now you know why, because it's putting pressure on that optic nerve. And you know how they take it out? It's literally like a hook just like this, or a latch hook, and they go up the nose. And the pituitary gland is like dangling, so they pull it out.
So you don't need your pituitary gland?
Oh, yeah, you do. But you don't need it if you have cancer on it, right? So then they're on a ton of hormone replacements because that's in charge of all of your hormones. So that's the prominent regions that you can see there. Now on this lateral view, I will show you where we went down from the longitudinal fissure. This is the area, the white matter that you see, is the connection. Those are called, this specific area is called the Corpus Callosum, and that's the connection between the right and left hemispheres, okay? So they do communicate. Now you'll see gaps between the areas of the brain. Of course, they are spaces that circulate and almost collect the cerebrospinal fluid in those regions. So we have a lateral ventricle, which is underneath right here, the corpus callosum area. And we have one lateral ventricle on either side, lateral, lateral. And then we have the third ventricle, which you can really see